Good afternoon, San Antonio, and welcome to this edition of Conversations with the 100. We got a great show lined up here in the Alamo City. We reaching out to you from San Antonio, Texas, the sunny city of here in South Texas. We got a great special guest. The 100 Black Men of San Antonio would like to welcome Dr. Travis back to the show. He's got a great lineup. We're going to be talking to you about some wonderful stuff this afternoon. And so, for the folks that don't know a lot about the 100 Black Men, 100 Black Men of San Antonio, we're part of an international organization, 100 Black Men of America, headquartered out of Atlanta, Georgia. Our chairman for the organization is Chairman Dortch, Tommy Dortch, phenomenal businessman, great thinker here in our nation. The 100 Black Men is doing some great things. Been a international organization since 1986, nearly 200 plus chapters around the world. Uh, the work that we do is all focused in mentorship. We have four key throngs, and that's leadership development, education, economic empowerment, and health and wellness, all anchored in mentorship. And so today, with what we're going to be talking about is with Dr. Batts is October is, I believe, Cancer Awareness Month, right, Doc?
Yes, breast cancer awareness. You are
breast,
correct.
breast cancer awareness. Okay, great. So for this show, we're gonna be touching on breast cancer awareness. We're definitely gonna be talking about mental health, how they link together, and then we're also going to be talking about the vaccine. Some of our key partners is, of course, the greatest fraternity in the world, Kappa Alpha Psi Fraternity Incorporated. My frat brother here on the show with us today. So SAC Alumni Chapter, we're in partnership, as well as the 100 Black Men, we're in partnership with Good Health Wins. And then also We Can Do This initiative, that's talking about vaccine health, mental health, all those great things that's packaged into one and how they all relate to one another. And so without further ado, you done heard enough from me. I'm gonna let this fabulous frat of mine introduce himself, tell y'all what we're gonna be talking about today. Dr. Batts.
Yes, sir. Well, Dr. Harris, thank you first for having me. And again, with that type introduction, I feel like I need to be running down the tunnel or something, getting ready to take the field. This feels like the Super Bowl. But when we think about kind of our role and what we should do in our community to galvanize health, to galvanize mentorship, to galvanize just a certain togetherness to improve how we're doing, it starts with this. It starts with a conversation. And you mentioned that, again, October is Breast Cancer Awareness Month. The numbers are still growing. Again, 12.5% of women will be affected. It is the number one cancer, again, for women and just across the board. And when we look at kind of health disparities kind of rearing their ugly head, it's not immune. And again, I wanted to say that because I know we have a lot to talk about on the docket, but just to make sure that people are aware, whether you are a woman and you're at that stage where you're getting, your evaluations and various things like that, I think we'd be remiss if we did not mention that, kind of given the gravity of it and how it impacts our community. When we look at the numbers, again, 12.5% calculates to about 1 in 8 women. I pause there. 1 in 8 women, and we all know at least 8. I'm thinking about my church members. I'm thinking about folks at my daughter's, Girl Scouts events, and it's those type things where, as long as we don't take opportunities to engage and have discussions like this to at least increase awareness about screening, about risk factors, about family history, something that we don't do in our community. I don't know how comfortable you're going to let me be, but we don't talk too much in our community. We keep it quiet. And the problem is, when we keep it quiet, it impacts not only just us, but generations to come. So again, if I could make one push, and again, we can stay here or move, is make sure that you're aware of when screening should occur. Make sure that you're aware of what your family history is around breast cancer and breast cancer awareness. And make sure, and we'll actually touch on this later, that you're doing the things you need to do to reduce your risk factors. And I'm going to throw a couple of them out there, right? So obesity, sedentary lifestyle. You say, hold on, doc, that sounds just like the risk factors for heart disease. Well, they are. Living a healthy life and improving things such as the sleep you get, reducing the stress, decreasing certain foods in your diet will certainly impact your breast cancer risk in a favorable way. All right. And that's, and again, so like I said, I'd be remiss if we didn't at least come out the gate saying we love our women, we love our community. And again, women, breast cancer is not only isolated to women. A very a small percentage of men can get breast cancer, especially when there are genetic components and genetic linkage patterns associated with it in that space.
Yeah, and so I was just sitting here listening to you, and you're thinking about, my wife, you know, mothers, grandmothers, daughters, co-workers, 1 in 8. That's, yeah, we all are affected by that. That's putting it close to home.
Right.
And in thinking about, cancer and breast cancer and mental health, and you talked a little bit about keeping it inside. We don't talk that much. How how does that affect the mental health when we hold all of that inside like that?
Oh, that's a great segue to kind of that point on mental health. And I think one of the toughest things is knowing the facts and then trying to figure out how to get them out there to our community, right? Because we're in the same community. I'm from North Carolina. I grew up to where if something's going on with you're gonna talk to God, you're gonna talk to a couple folks, but you're not gonna let people know. And I think that's one of the things that um, have impacted us negatively. There was a study done a couple of years ago where it looked at the likelihood of an individual going to talk to someone about mental health concerns and challenges, right? And what they did is they looked at, again, race, they looked at gender, to some degree, socioeconomic status. But what they found was that African Americans, right, particularly African American men, are the most likely to not engage in a conversation about mental health and about mental health awareness. And where we saw this kind of, again, I keep using this term, kind of rear its ugly head, was when COVID occurred and you started to have even more separation, where before you could go to your barber shop, and my barber, shout out Will Scott, it is it's therapeutic, right? And irrespective of what we're talking about, just knowing that I have a place where I can sound off, just knowing that I'm in a space that's safe. And I think that's the one thing when it comes to mental health. We don't want judgment. We don't want individuals to draw back from us. So I think as men, and I know this show and your platform reaches multiple folks, but I'm really speaking to men. As men, there's a certain toughness that goes with being able to handle that mental health piece.
Mm-hmm.
And when we see it kind of in front of us, take the NFL, for example. Right? I mean, you look at the examples that have occurred, and I'm not saying that kind of the separation in the context of COVID and how it mixed things up was directly proportional to that. I mean, I think a lot of these things may have been going on, but I think it highlighted it in a way that made all of us kind of take a step back and pause. So much so that the American College of Cardiology, of which I'm a fellow of, an affiliate with, back last summer had what they called COVID conversations. And one of the biggest ones was, again, that conversation about how that movement of mental health and the, I guess, lack of push of individuals to really reach out. Because once we started going virtual, which I like this platform, this is great, but once we moved away and people started, that's when people really realized, man, I'm alone, I'm on this island. And what it takes is for individuals such as yourself, individuals such as me, is to reach out and to look, whether it's a fantasy football group that you have or whether it's a church group that you have, make sure, and this is what I tell folks, make sure that people are okay.
Mm-hmm.
Because the knee-jerk reaction is to come back and you say, hey, how you doing? Oh, I'm good. Well, what's that mean? Right?
Right.
Does that mean you good right now or you weren't later? There's another podcast that I really enjoy. It's called the What's Your Revolution podcast by Dr. Charles Corporal. And on that, his whole goal is to bring men of color doing dope things and helping people, right? And again, not that exact term, but that's how he uses it. But much of the discussion is about mental health. It's about wellness. It's about self-actualization in a way that allows you to empower yourself, not to say I'm immune to mental health, but it allows you to recognize it, appreciate its potential impact on you, and to not be fearful to seek help. So again, in those three things, kind of that recognition, kind of that not being fearful to seek help, and knowing its impact, I think are key, especially for our community as we move forward, whether we're post COVID or going into a new phase, or transitioning into an influenza COVID space, because we're going to talk about, I know, some of those things, but it's still out there and it's still impacting our community in a very significant way.
Wow, that's powerful, Doc. And before we get too much further into this conversation, we didn't go into your bio and letting folks know why we wanted you on the show, and for you to be, you know, kind of like a theologian of this subject matter. So let's go into your bio a little bit. Let the folks in the audience know who about your background.
See, because you know I'm actually very shy and super humble, so I don't like talking about me. But you go make me talk about me. Well, well, I'm Dr. Travis Batts, and like my mom said, you were a whole lot of things before you were Dr. Batts. So I am Travis Batts. I am again a father, a son, a brother. And just a resident of San Antonio. Now, my background, I'm originally from North Carolina. I went to college on a track scholarship, University of Kansas, again, Rock Chalk Jayhawk, and enjoyed myself there. Got a degree in biochemistry, loved it so much, learned kind of the ins and outs of biochemistry, a little bit of the business side of things, but realized that I can move in that space in pharmaceuticals, but I really wanted to impact my community in a more hands-on way.
Mhm.
So I got into the University of North Carolina at Chapel Hill School of Medicine and finished my training there. Went to came to San Antonio, active duty military, and in that space did all my training here, my internship, my residency, my internal medicine staff time, and cardiology fellowship. And I always tell folks, cardiology, I didn't choose cardiology, cardiology chose me,
Okay.
because cardiology is one of those professions where I always joke and say it's a profession where I get to watch TV, play video games, and talk to people. Now, you got to bring me back so I can explain what that means. But every day is a new challenge. I enjoy what I do. There's not a morning that I don't wake up that I'm realizing, man, there's so much I don't know. Or
Mm.
at the end of the day, where I'm talking to my patients and they're telling me different things about how they've changed their lifestyle and moved more plant forward and those type things. And if you all follow me on any social media outlets, you all know that I am plant-based, meaning I don't eat any animal products. My wife is not. She's what I like to call a flexitarian. She's pretty flexible. If I cook a good meal that's plant-based, she's gonna eat it. But and uh, uh, as we said earlier, I'm a member of Kappa Alpha Psi Fraternity Incorporated. And again, through that mechanism, and again, Dr. Harris spoke about it, through Good Health Wins, to our community engagement, it's allowed me to further bolster my desire to really give back. And what I tell folks is, you never know how long you're going to be in one spot. You never know. But you know what you're doing at that moment. And as long as you're taking steps forward to improve the environment you're in, you're adding to the collective goodness of where you are. So, and that's my goal. That's why, again, it's not about me. It's about kind of making sure we're able to do the things that we need to do to help our community. So that's enough. That's enough about me. Let's talk about some other things.
Absolutely, absolutely. Well, definitely uh, impressive background. Hats off to you for doing the great things and giving back to the community in the way that you do. Thank you for your service in so many ways. In addition to being a physician, your military service. So just you know, hats off to you, and thank you for your service and your commitment to this country at so many different levels.
Yes, sir. Thank you.
So cardiologist, that's hard, right?
That's hard. That's
That's
hard
hard.
all day.
Wow. So let's get to the harder things then. So absolutely, absolutely. And so let's talk a little bit more about Good Health Wins and what this Good Health Win initiative is really all about and trying to do.
Perfect. So Good Health Wins is a program that is geared towards improving health awareness in, and I would say, underserved communities or underrepresented communities. But when I look at what the San Antonio Alumni Chapter has done, they've reached all communities, and I think that's That's a good starting point. It initially, in the context of COVID, what we realized was that communities of color, underserved, marginalized communities, oftentimes for fear of just not knowing about the vaccine, not knowing about the dangers of COVID, were reluctant to receive the vaccine. As we know that the risk of getting COVID versus the risk of getting a reaction to the vaccine are essentially 500,000 to one. So, and again, that number I'm throwing out there simply because it is a very, very low risk of complications. And do I see those folks with complications from the virus? I do. But what we wanted to do was dispel myths in the African American, the Black, Brown communities, different communities, and just have an opportunity for them to engage with individuals. First off, with vaccines. That was our initial push. But over time, what Good Health Wins has done, it has evolved into this behemoth, so to speak, that is focused on community health. Each month, there's a different Good Health Wins target. This month, again, and that's why we spoke to some degree on mental health, is mental health. Of course, COVID, but COVID in the context of mental health and what that means. And as we move forward, each month there are different initiatives. But Good Health Wins not only stops there. What they do is they expand their reach. And so the San Antonio alumni chapter said, hey, we've got, a push for vaccines, but why not work on changing policies that create issues in our community, whether they be from a health standpoint or from a social justice standpoint? Dr. Harris, both you and I were a part of the State of the African American Community in San Antonio and Bexar County report, which I was a super small part of. I was with luminaries such as yourself, uh, uh, Dr. Blunt, just different folks, and just hearing all the things that are going on. And again, when you look at the platform of how Good Health Win reaches out and does what it needs to do, it builds on things that just like that we started in that program.
Mhm.
Now, the other piece, now I talked about vaccines, I talked about voters registration and different things like that. We also had a big push, and I think this aligns very well with the 100 Black men for health, right? Just general health, just irrespective of the vaccine, irrespective of what you do with public policy. Again, Good Health Wins provided an umbrella to say, hey, we still want you to be healthy even after you've been vaccinated, even after you voted. And so there was a push for, again, they asked me my idea. I said, get people eat more vegetables and exercising. And so again, the San Antonio alumni chapter made a push to do a movement called Vaccines, Veggies, and Votes. And, a year into it, we are still working great, whether it's at the food bank, whether it's at nursing home, whether it's through Northside Independent School District, with a host of different community collaboration, whether that be the San Antonio Metropolitan Health District, the Leal Pharmacy, ADMT Solutions, University Healthcare, man, you name it, the Divine Nine, just everybody partnering in a way that focuses through collaborative efforts under the umbrella of Good Health Wins to ensure that our community is vaccinated, that we are ready and mobilized to vote, and that we ultimately get out there and remain healthy. I know that was a long answer, but I told you it's a big program, and again, man, I'm excited just talking about it. I told you you should have put a stop up here because I can keep talking. It's a great program.
Yeah, that's great. That's great stuff. And with the 100 Black men, that's why we wanted to align ourselves when we became a part of the We Can Do This campaign that focuses on that education around vaccines, uh, getting more folks in the minority community vaccinated, and then that ties so much into mental health. And so, with the work that we're doing for the We Can Do This initiative, I know there's a lot of trepidation, if you will, especially in our community, in the Black community, about should I even get the vaccine, right? The first one, let alone a booster, right?
Mm-hmm.
And so I hear all the time, and I won't say all the time, but I hear often that we've all heard the term that when someone shows you who they are, believe them. So in our
Yes.
community, there's a lot of folks that say, "Hey, the United States government has shown us who they are."
Uh-oh.
And it hasn't been favorable to the Black man. And so why should we be so eager to say that we can do this and go out and get these vaccines and the boosters when the government has just not always been the best friend to the black man in this country.
Ooh, you came right out the gate with that one. See,
Yep.
I was
You know,
prepared for
we
you.
keeping
You
it
weren't
real
playing.
now.
You okay? You keeping it real? I was all right. No, and I'm laughing because about 2 weeks ago, so I pledged. Well, I went through the process of becoming a Kappa at the Mu chapter, the University of Kansas. We
Okay.
just had our 102nd kind of anniversary. We were founded in 1920, and there were brothers there who were 80 years old, 70 years old. And not only when I would come around, and they know who I am from a physician standpoint, and they say, "Oh, I don't eat like this all the time." I said, "Brother, go ahead, eat." So they hiding ribs from me. I'm like, "You ain't good, brother, you all right?" But the biggest question was, how do you trust the government to administer a vaccine when we've had years and years and years, and I can go on, of actions that have been less favorable to us as a community.
Mhm.
There's a good book out there. Again, the author escapes my name. The title doesn't. It's called Medical Apartheid. And it talks about the institutional structure in the healthcare system um, that disproportionately test, disproportionately kind of undertreats, and disproportionately less favorably manages the healthcare conditions of communities of color and underserved and underrepresented communities. And that book goes through this historical anthology of such. But when it comes to the vaccine, right, and this, my feelings on it are that I see both sides of it, right? And I see the people, you know, I've got patients who, again, I'm a heart doctor, right? So I've got young patients with heart disease, and I've got a whole host of older patients with heart disease. And what I've been surprised about is that my patients, whether it's, and I'm not saying it's due to me, I think my patients are brilliant. They said, "All right, Dr. Betts, I want you to tell me the pros and cons of getting a vaccine. I want you to tell me the pros and cons of not getting a vaccine and getting COVID." And it's a fairly easy conversation. That the vaccine can affect the heart in three ways. One of them is through direct viral invasion. That's rare, occurs probably less than 3% of the time. But when it happens, it's huge. That's what you hear about when they talk about myocarditis, where the heart gets inflamed, right? So that's one thing that can occur. The second thing that can occur, and we think that this is again a little higher than that, is this underlying thrombotic. Now, just think about thrombotic process as being your blood is like oil, right? It's not that thick, but as it gets more thrombotic, it gets more viscosity or thicker. So think about sludge running through. And again, that's not super common, but it can occur. We know that there's a thrombotic. That's why people that that do unfortunately contract COVID end up with kind of strokes and heart attacks and various things like that. That's the other piece. Probably the biggest piece, and this piece holds true whether you're old, whether you're young, is the underlying systemic, meaning your whole body undergoes inflammation, meaning there's an inflammatory process, meaning, if you can think about just how you feel when you get the flu and those type things. And for 60% of folks, they get through it and have no issues. For 10% of folks, they have some challenges that are far prolonged, hospitalization. These are the folks that are on, that have those other challenges. But there's about a population of about 30% of people, of all the people that get the COVID-19 virus, that have a condition called long COVID or post-acute sequelae of COVID. Big words that just mean you still have this smoldering fatigue, brain fog, just, shortness of breath. And I see it in the 19-year-olds that I take care of, the 25-year-olds that I take care of. And when I track back to see how they got it or what happened, guess what?
Mhm.
I didn't think the vaccine would help. I didn't think I would get it. And those are the things that, because I see both sides. And now, have I seen, the few cases of vaccine associated myocarditis? Sure, I have, right? But to date, now again, I can go back and look at the literature. There has not been a death from that. Now I know you're saying, well, Dr. Bass, that's not very reassuring. You're comparing the death of getting X to this. But no, but we know that very early on, we had thousands dying per day with COVID. And so when I look at it and I say, well, are they specifically targeting our community to test this on? No. I think the U.S. probably was a bit more conservative with this distribution than many other countries.
Mhm.
Um, I was actually in Afghanistan when I received my first COVID vaccine, and we had a choice, right? But after I saw folks come in that looked like me, that were young or that were healthy, that I could see it shut them down, I said, let me see the likelihood of risk, or a 1 in 250,000 chance that I could get this, or a 1 in 500,000 chance that the vaccine would cause this. Or that was an easy deal. That was an easy deal. But I know that it has affected people, and I am sensitive to that. But I would say that in terms of the government specifically targeting certain groups, not with this vaccine, because when you look what it's done to our community, from my dad always say, when you really want to figure out something that's going on, look at the money trail. What it's
Mhm.
done to us economically, it behooves the government to improve that we have a healthier workforce, and the things that they roll out is really what we want to do to ensure that we can do that. So hopefully that answered the question. I know I
It-
talked a little bit of pathophysiology, but that's one area that is, I'm still passionate about in that sense, and hope to dispel some myths as we continue to evolve.
yeah, yeah, and that response is going to be very, very helpful to our listeners. And I'll just add, when I get questions like that, and at some point in my journey, I had them. I would make comments like that, and and so with the Good Health Win campaign and the We Can Do This campaigns, as we think about, especially when you talked earlier and you mentioned that you don't eat animal products, right? And I'm I'm trying to transition and get there. My brain is not totally wrapped around it yet, but I'm going to commit and say that I am going to get there. But it's going to be a challenge because I grew up on pork and all that kind of stuff. I grew up in Marietta, Arkansas, a little small
Okay.
country town, and you know pork was breakfast, lunch, and dinner. And so it's difficult trying to rewire yourself. But when I get questions like not trusting the government and things like that, you know one thing I can say is, for us, that we can do this, and good health wins for us as a people. If we can get to around to not eating animal products, that's a plus and a win for us. Because what I do know is that there are more deadly chemicals in just the routine meat products that we eat on a daily basis that's
Speak on
doing
it.
more harm and attributing to the breast cancer and prostate cancer and all these other things that that's more deadly to us than these vaccines. And
Right.
so if we're comfortable eating meat products, why can't we be comfortable getting vaccines?
That see, I'm gonna use that. That's gonna be my next campaign. You ain't watching what you eat, but you watching what vaccine you get. But no, it speaks to that point, um,
Exactly.
of understanding that, and so that is huge in the sense where we. So, for instance, the example I'll give is processed meats. Not granted, you Arkansas, North Carolina, I still remember taking that bologna, making sure I cut the edges so when I put it in the fry, it don't roll all. I remember that was a long time ago, but I still remember.
Mm-hmm.
But the US is one of the few countries. So if you go to Europe and you try to get bolognas and salamis and various things like that, they put a little label up there. They say, hey, the World Health Organization says that this is a class 1 carcinogen.
Mm-hmm.
Carcinogen means that it causes cancer. We know
Mm-hmm.
that processed meats, the accumulation of, or the volume of that over time, increases your cancer risk almost exponentially, right? And it is a dose response. And every day that you eat those things, you're giving yourself a little dose, a little bit more dose, a little bit more dose. And so it's not until we understand kind of the impact that that food has on our body that we can make a substantive change. And what I tell my folks is, it's not about perfection, it's about progress.
Mm-hmm.
And I help my patients through. There's a I'm about to say 12-step, a 12-week program that they go through where we learn about portion size, we learn about meal frequency, we learn about plate composition, we learn about kind of the choice of how you prepare your meals. But nowhere in there did you hear me say, I teach them to be vegan or to be vegetarian. Ultimately, I want them to be intentional about what they eat. And as you start to add intention to what you do every day, it makes it much easier to make the decision to say, you know what, maybe I'll only eat half of this 8-ounce steak on Monday, and I'll eat the other half on Wednesday or Thursday. And then the rest of my plate will be, and so it's taking those steps. Now, is my goal to get them to a more plant forward diet and lifestyle? Sure, right? But the one difficulty with the word change is one letter. That letter is that G to a C. You got to take a chance. You got to, and it sounds like you're already doing that. So now the problem is you let me know. So now I got your number. I'm gonna be checking on, hey, what you eat this week? I'm not gonna be doing that.
Hey, hold me accountable.
But that's what I was gonna say. Accountability partner. That's what. So usually when one of my patients wants to transition their diet and they want to engage in a healthy behavior, I usually say, bring your spouse with you. Right. And the reason why I do that is whether their spouse needs the transition or not, it's much easier when someone else hears you have a self-actualizing event. Right. If they say, okay, doc, by December after Christmas, a lot of my patients make these after Christmas. They don't make it between Thanksgiving and Christmas, but after Christmas, I'm going to do X. I said, all right, well, I'm going to talk to you in January and see if we've made that change and just help us to keep pushing. And by involving the spouse or a friend or a family member or a group, right? The 100 Black men, I mean, you get 10 pockets of 10 men all working to, kind of get what they need to do from a nutritional standpoint and having a nutritional accountability partner. I mean, that is a powerful tool. And we know that it will promote change and sustain that change long term, I think is also a big thing. So I'm going to be working on you, brother. I'm going to be working on you.
I receive it. I receive it. We was just introduced to a new group that was started by some military veterans here in the city. It's called Man Cave, and their focus is on mental health of Black men.
Oh, beautiful.
And they're now partnering with our organization, and they do a lot of work. And one of their health and wellness initiatives is getting off of meat products and eating more fruits and vegetables. And so that was just, it was confirmation for me because I had been thinking about, trying to transition off meat. And I've really been talking about it for years.
Mm-hmm.
Key point, talking about it and not really doing anything about it. And so, I've always been told that the best time to start anything is today. And so
Right.
I know that, I'm transitioning from that, saying that I'm going to do something, and I'm starting to say, you know what, this is done. I start today, and just working into it. And I think, just educating ourselves, like you mentioned, the what did you call it? The carcinogen,
Carcinogens.
carcinogens that's in
Mm-hmm.
the product that cause cancer. And that's almost any kind of meat, whether it's packaged meat or the deli meat or
Right.
chicken steaks that we eat, all of these animal products, because they have to preserve them. And I think is that
Exactly.
preservative that they put in there to keep that meat from spoiling?
Right. And there's a host of different ones that, to try to keep the meat from spoiling and doing different things. And even you had mentioned, and it's usually those meats that are ultra processed, meaning you can't go to any animal and slice off a piece of salami. That does, it is processed out of its natural form, right?
Right.
Hot dogs are notorious, right? But at the same time, when you look at things like chicken, right? Which again, I'm not as people transition, however they do it, I'm there to help them out. But one thing that a lot of folks do is we sell chicken, not folks, but companies do is they sell chicken by weight, right? So the way that you can make a chicken's weight go up in the growing process, of course, is hormones and steroids. They say, well, Dr. Batts, I'm getting no hormone, grass fed, range, crazy, whatever, cool. Okay, I get it. But while they're in the store, it's still per pound. But if I inject a piece of chicken with a little bit of a sodium solution, that's salt, and soak it in water, and basically water follows the salt, that water gets into the chicken, and before you know it, you've increased the cost by a little bit, but you've increased the cost by adding more sodium. And so on the flip side, how many people soak their chicken in water to hopefully get the sodium out before they cook it? Not many. Like even with me, I'm plant-based. I eat, less chickpeas or garbanzo beans. But I got to be careful. High sodium. So I got to pour those in the strainer and wash them and rinse them and soak them just to get some of that sodium out. So again, and not to overcomplicate it, but I think it just starts just as you said, just thinking about it and being intentional and finding a strategy. And that's what I try to do to help people develop a strategy so that they can have success at wherever their dietary or lifestyle track takes them. And that's really what I want to provide, and really what I want to do, and what I think organizations like 100 Black Men, like the San Antonio Alumni Chapter, like Good Health Wins are doing to ensure that we provide folks a strategy, education, as well as information on how to make informed decisions.
Yeah, that's great stuff, and I know both Good Health Win initiatives and the We Can Do This initiatives. There's a series of vaccine clinics that's going on. I think on a weekly basis around town.
Mhm.
Talk a little bit about that.
Yeah, so the vaccine clinics, and I know that through our partners, again, I've listed them already, but through our partners, there's a host of different places around town. Now, something I won't say new, they've been doing it, but I just found out about it, is that they've partnered with, you ready for this? School districts.
Hmm.
Northeast Independent School District, Northside Independent School District. And then they've also built some collaboration with HEB and other folks. And so they are encouraging people. I won't say what they're giving because it changes, but encouraging people to come out to those. And those are occurring almost, if not on a daily basis, but definitely on a weekly basis. And then our other pockets, through again the university health system, Leal Pharmacy, other things that kind of push that in a space where we're making the vaccine available. We, in some cases, they're looking at even bringing the vaccine to you. So I know there are folks that have family members that are in nursing home health facilities. They're saying, hey, we can take a vaccine truck out there. The San Antonio Alumni Chapter did a big push at a local nursing home. And again, I don't know the exact number of shots in arms, but I certainly, by the pictures and by what they showed, they had a whole lot of smiles on faces. And part
That's
of it was showing people that they cared. They cared enough to come out and visit. They cared enough to come out and say, let us provide you with protection. And whatever the choice you make, we're still going to be here to support you in any capacity.
Yeah, I know we've been volunteering with Leela Pharmacy and Antioch Missionary Baptist Church and some other partners, and they've literally been doing 75 to 100 vaccines a day in partnership with a lot of these organizations. And so it's all about awareness, and getting that vaccine is really about yeah, you want to protect yourself, but you want to protect your neighbors as well. And so
Exactly.
as we recap today, we talked about cancer awareness with this being Breast Cancer Awareness Month. We talked about mental health awareness, and then of course the COVID-19 vaccine awareness, and so that central focus is really just awareness. And
Right.
so talk to us more about that and how we can reduce some of this anxiety that affects our mental health, make ourselves more aware so that we can make better educated decisions on protecting ourselves from cancer causing diets or just unnecessary stress around vaccines or whether we should get them or not or whether the government is ploying and that's how do all that tie in together.
It's tough to tie all that in together, but we're
Mhm.
going to do it. And so, what I usually have folks do is to try to isolate again their global health down to a saying that I ask my patients. And I ask them, did you take your meds? MEDSSS. You say, hold on, Dr. Bass, we supposed to be, trust me. So, the first M is mindfulness or mind body wellness, right? And really, that's where I start because a lot of folks don't realize that it's not where it needs to be, present company included. How many of us kind of meditate 1, 2, 5, 7 minutes a day? No, we're so busy. And what I see that as is an exercise to push things out of our brain in a way that allows us to really clear our mind to make more aware and more informed decisions. So that's
Mhm.
M. E, exercise. Too easy. The American College of Cardiology, the AHA, they recommend at least, this is that low number, 150 minutes a week, broken up however you want to. But I tell people, exercise, you don't need a gym, you don't need a special workout routine tape. Just do something.
Mhm.
Whether it's going to HEB and saying, okay, I'm going to walk every aisle down and every aisle back, and then I'll start shopping. That's a plus. It's a controlled environment. You don't have to worry about the weather. And again, HEB knows you probably gonna end up buying something while you're there, so they're not gonna have a problem with it. But it's finding those ways to improve our awareness, to improve our activity in a safe and controlled manner. All right, so that's MED. You know what D is? That's diet. Now we've talked about strategies to how to improve that, but now whether it's going online and reading alternatives, something that I challenge my patients to do that are looking at transitioning, is I say for the next 12 weeks, every Monday, what I want you to do is just Google your favorite dish. That's it, whatever it is, and then put vegetarian or vegan or low sodium in front of whatever your favorite dish is and pick a recipe. Don't even cook it, just pack it away. By the end
Mm.
of 12 weeks, guess what you got? You got 12 recipes that are either vegetarian, vegan, low sodium, low, however you want to frame it, whatever you need from a nutritional standpoint, you got 12 options right there that you know you're going to like. You just have to put them together, right? That's D. The first S, all right, now this one I got to work on, sleep, right?
Mm.
Sleep hygiene. We know that if you sleep less than 6 hours or more than 9 hours, your risk of cardiovascular disease goes up in a linear fashion, meaning your risk of heart attack, stroke, or cardiovascular death goes up about 15 to 20% over time. So, what I've tried to do is make my patients informed about the importance of learning how to rest, particularly sleep. Then we transition into substances. Now you say, what substances, Dr. Bat? So risky substances, right? So tobacco, again, is declining, but with the obesity epidemic going up, we kind of were a null in terms of what we wanted to do for cardiovascular risk prevention. Whether it's, taking that supplement that sounds good, but you won't change your diet, but you'll spend $50 on a supplement that someone told you will help you lose weight. Just
Mm.
watch your diet, right? So because not all supplements are created equal. And sometimes I'm hearing folks putting things in their body, they don't even know what it does. Because usually when I see patients with supplements, I don't tell them to stop them. I say, well, why are you taking it? And if they don't have a good answer, I say, that's just like someone telling you this is gas to put in your car. You're not checking and you just pouring it in your car, hoping that you're going to get from point A to point B. So be intentional. And as you said, improve your awareness. Now that's MEDSS. We got one more S and then we're about to be done. You ready for this one? It's what we're doing right now. Social connectedness.
Mm.
Find something to get involved with, whether it's 100 Black Men, whether it's Good Health Wins, whether it's a local fraternity or sorority, whether it's a church. I can tell you, my church, Macedonia Missionary Baptist Church, has basically COVID testing, has vaccines, we're about to start a program called Fitness and Faith, where it's a faith-based program focused on youth, where they're going to come exercise for 30 minutes and then get some church too. Again, whatever your belief system, you got to find something to be involved or to be socially connected, because by doing so, it allows you to really strengthen and galvanize those other aspects that we talked about. So whether it's mind, body health, exercise, diet, sleep hygiene, getting rid of risky substances, and finally staying socially connected, that's a way to ensure your longevity, community growth, and awareness so that you can move forward and make better health informed decisions.
Mm. Wow. You mentioned Macedonia. It's Pastor Daly, right? Another one
That
of
is
our
Pastor Day. That is a frat brother.
right? And so the community should know that the capitals are all about achieving at every field of human endeavor. And so
Yes.
capitals are doing some great things around this city, some known, some unknown, but that's okay, you know,
Right.
because it's all about achievement. It's all about keeping folks aware. So we want to thank Dr. Travis Batch today. We're going to give him an opportunity to give one last round of closing words. Talk about anything that he'd want to talk about. Closing us out today, but we want to thank our partners, Kappa Alpha Psi Fraternity, Good Health Wins, the We Can Do This campaign, 100 Black Men of San Antonio. It takes a village, y'all. It takes a village. So it's all about keeping ourselves aware, making informed, intelligent decisions, not getting caught up in the weeds, not chasing every conspiracy theory that may have some truth to it, may not, but just keeping ourselves aware and making an informed decision. Dr. Bass talked about meditation. So one of the things we did talk a lot about in this session is that spiritual awareness, that spiritual connectivity. A lot of answers that we seek in this world are already inside of us. We tap into them through that connection with the spirit. And so, but that's for another show. That's for another show. But you know, meditation is a quick path to getting to know your inner you, where that spirit resides. So we hope you take what Dr. Batts has given us, the food and the wealth of wisdom that he's presented today. And again, just thanks to all of our partners. And then one last time, I'll hand it off to Dr. Batts to close us out in any way he feel appropriate.
Well, Dr. Harris, again, I am very, very rarely lost for words, but just how you speak and what you have said about the importance of meditation and connectedness and what your role is, not only in your organization. And again, I wish you could have told your bio. I'm already trying to get your autograph, but I just love the work that you're doing, the passion that you have about it, and the purpose that you have. Because what I tell folks is when you're living your purpose, it doesn't feel like work. It
Exactly.
feel like I'm supposed to be doing this, and just being with you on this call again has been great. So thank you for having me. For those of you all again kind of watching and wondering what's next, okay, I'm empowered, I got this meds thing, I'm working on these things. I'll continue to be working with, again, 100 Black Men if they'll have me. I'll still be working, of course, with the San Antonio alumni chapter. We have a host of different events. I would say follow both these organizations on Facebook, Instagram, if they're there, all their social media platforms. Something that I'll be doing that, again, it's been impressed upon me in multiple venues. I'll be starting a video podcast with the first episode set to launch in a week. So you all definitely keep me up in that space. The title of the podcast is About That Life, LIFE. And what life stands for is living intentionally forever. And that's really what we talked about on this conversation. We can do this. And I love the title of that initiative because when it talks about living, when it talks about being intentional, you can. You just have to see a way forward. I just have to see a way forward. But we can do that by, instead of trying to push through it ourselves, is to reach our hand out, grab some other folks, and move forward with them, because we're always going to have strength in numbers. So I would encourage you to continue to, watch programs such as this, engage in community activity, and always remember to stay intentional.
Wow. Wow. Powerful segment today. And we couldn't close this out, San Antonio, without giving a shout out to the fabulous, fabulous Miss Laura Thompson, founder of TAN TV, who hosted us here today. Great, great network and platform. You can Google them on just Google TAN TV. You can look them up on Facebook and LinkedIn. They always have a lot of great content. And I can see them soon. I know they've interviewed Dr. Batts in the past, but I can see them facilitating that podcast as well. So be on the lookout for that. Again, hearts out thanks to Laura Thompson and the TAN TV family. We'll see you all next time here on Conversations with the 100. My name is Milton Harris. Peace and love to you. We'll see you next time.